What are your views on laser removal for a mole? Pretty limited use for laser for moles, in my view. I don't do laser mole removal, so if you did want to consider having your moles removed by laser, you're probably better off seeing someone who does do it. So I don't do it. That's number one. Number two is, generally speaking, for most moles, brown moles, pigmented lesions, it's good practice to send them off for histology, and that's one of the main drawbacks of laser, that you can't send them off for histology because laser will kind of destroy them, burn them, whatever. So that is the number one drawback of laser, is that you cannot send them for histology. But you might have a mole that you won't be sending for histology, and I think laser really comes into its own when you have multiple. If you have multiple lesions, should we say, maybe not moles because you may, but skin lesions, then laser is kind of quite good, quite kind of quick. So laser is good for that, for multiple lesions, and I guess for lesions that you're not going to send for histology. I've always said that the issue when you're removing a mole is that you've got to remove enough tissue that you remove the mole, but not too much tissue that you create more scarring. So the more tissue you remove, the more scarring you're going to get. The less tissue you remove, the less scarring you're going to get, but there's a risk you might leave some mole behind if you don't remove enough tissue. So that's the balance when you're removing moles. And I would say that by doing surgical excision, you got a better control over how much tissue you remove, and it's potentially a little bit more difficult to remove, to make sure you've removed enough, destroyed enough with a laser, because, as I say, if you do too much, you're going to get more scarring. If you do too little, you might leave a bit of the mole behind.